With that aside, I get to introduce one of my favorite people in the world. If I was younger than her, I'd like to be like her when I grow up, but darn, I'm a little older. I've worked with Dr. Johnson for the last 20-some years, maybe not quite 20-some, but at Legacy. She is currently our medical director and has been of the Legacy Cancer Institute. Dr. Johnson is a surgical oncologist with the Legacy Medical Group. Her CV is as thick as about this. She speaks all over the world. She's always willing to present to small groups, to large groups, and always does it with, enthusiasm and a great deal of love and knowledge. Dr. Johnson this past year has joined the Sisterhood of Cancer Survivors, having gone through the breast cancer experience herself, so brings even more knowledge to what that experience is like from the inside. In 2012, she was in the top surgeons in the United States. She's been in the top doctors in Oregon year after year. She's written a book, When Mommy Had a Lump, a few years ago for young children whose parents or mothers have had cancer. There's pretty much nothing she hasn't done, except there was something new I didn't know about her after all these years. And those of you who were in the previous session, I apologize if this is a repeat. But I opened up the paper yesterday, and there it talks about Dr. Nathalie McDowell Johnson, a prominent Portland physician. Well, I knew that. Especially well known in breast cancer, I knew that. But less well known for her previous profession in ballet. And she's been nominated by the governor to join the Oregon Cultural Trust, which she has accepted. And what she quotes, a Cultural Trust news release quotes Johnson, "I would love," she says, "to make sure all Oregonians have the opportunity to take part in the culture, art, and heritage that is available. My mother taught us that with imagination and creativity, there is no time for boredom." And having worked with Dr. Johnson for the past 20-some years, there is no time for boredom with this woman. I get emails, 2 o'clock in the morning, "Selma, about that dance class you were going to put on for our cancer patients. Selma, I just had an idea. We ought to paint a mural on the parking lot. Selma, by the way, I had another idea." And the thing is, she generates those ideas, and we all move forward with them because she has the enthusiasm, the drive, and often the research. One of the things I remember about the past when sentinel node biopsies were not happening, Dr. Johnson was the first one in our area on this side of the country saying, we need to do that. And there was a lot of pushback from other doctors. Oh, this is just something new. But truly, she is a surgeon who is always on the cutting edge. It's my joke. So welcome, Dr. Johnson.
Thank you so much for that kind introduction, and I'm laughing because it's so true. So, really, 2 o'clock in the morning? So thank you. I'm so happy to be here and to talk to you about the environment in breast cancer. And my partner, Dr. Jennifer Garreau, is to give this talk. But she had a family commitment. She was so enthusiastic about talking today that she agreed to do it right away and forgot that her husband had planned a family trip to take their 4-year-old for her first time to Disneyland. So she was actually going to cancel and come. I'm like, no, Jen, go to I think I can do it. So hopefully next year you'll get to hear from Jen. She's absolutely amazing and wonderful, and actually was my surgeon. So without further ado, let's kind of talk about the environment and breast cancer. So I'd like to tell you that we're learning more and more that the environment, what we eat, where we live, is really impacting the incidence of breast cancer. Coleman's actually sponsored a lot of the research that's moving this forward. So I included this slide not so that you could read the whole thing, but just to kind of show that Coleman's funded research that the Institute of Medicine did on environmental risk and causes of cancer. They've also funded USC and Harvard's medical school looking at environmental risk and breast cancer. So when we get out there and racing for the cure, it's actually going to more than just researching drugs, but trying to go upstream and find out why are so many of us falling in the water, including me. So what we've seen is that really it's something important. We haven't focused on it. I think over the years, most of all the dollars have gone to research on therapies, when really we do need to be looking upstream and looking at prevention. Last year, the President's Council, panel came back saying that they really need to put more emphasis on looking at harmful exposures and how they can be prevented. So let's look at some statistics that might implicate the environment. Breast cancer is actually one of the top cancers that affects women worldwide. So it's not just in the United States or Europe, but we see higher incidences of breast cancer in Africa, South America. It's worldwide. In the U.S., since 1973 to 1978, it increased by 40%. So when I first came into medicine, it was 1 in 12 women got breast cancer. Now it's 1 in 8. Why is that? Is it food and packaging? Is it more chemical derivatives? Is it medicine? Is it some of the things that we do to people that are causing it? We do know for sure that when the Women's Health Initiative study on hormone replacement therapy showed that it was associated with an increased risk of breast cancer, and the use of hormone replacement therapy dropped off a lot, so did the incidence of breast cancer. So we do know that there are some things that we're doing that are maybe increasing that risk. When we talk about environment, there's a physical environment, then there's your genetic environment, the things that you bring that you have no control over, you were given to by your family. Food, and then culture habits. So there are things that you are in control of, and then there are things that you're not so in control of. But luckily, most of the things that put us at risk for breast cancer are things that are modifiable or things that we ourselves have control over. So we can be empowered to change some of those things. So you can do things to decrease your risk of breast cancer, and more importantly, change the things that you do for your family so that you can decrease the risk of cancer. So the first factor that you can control is smoking. And that definitely is modifiable. Smoking, I say it, I know for people that smoke, it's really difficult. It's not, just quit smoking. It can be very hard, but you need to talk to your care provider about it. There's a lot of help for people who want to quit smoking. And so just be proactive and do it. And the more often you try to quit, the more likely you'll be successful. So just because you've tried once and you didn't do it, if you try again. Alcohol is a modifiable risk factor. So there's a lot of talk about it. What's safe? What is a safe amount of alcohol? I think a glass of red wine, or I say a half a glass of red wine. When we say a glass of red wine, we're not talking about to the tippy top. So half a glass of red wine a day is actually good for you. It's good for heart, and a lot of cardiologists actually tell their patients to have a glass of red wine at dinner because it improves heart health. But if you have it to the tippy top or you go to the second or third one, that's a problem in terms of cancer risk. So it's not that you can't have alcohol, it's just be sure that you're doing it in moderation. Monitoring weight gain. So especially weight gain after menopause. If you gain a lot of weight after menopause, that does increase your risk of developing breast cancer. So some of that probably has to do with fat holds on to estrogen and progesterone. So if you are overweight, you have higher levels of estrogen, and that may lead to a higher risk of breast cancer and actually other cancers as well. Movement of all types is good. So for people who saw this last time, I just stuck this in because I just thought it was really funny. So movement is good: walking, swimming, biking, dancing, including twerking. Zumba, Pilates, and then last session somebody yelled dragon boating. Yeah, so that's good too. So anything that gets your heart rate up and moving is excellent for you. So our built environment is not something you have a lot of control over. So the quality of the air where you live, you can advocate for those things, but you deal with where you live. And one of the things that you can do is try to monitor, like, when you're out, if you like to go walking, try not to do it at the height of rush hour when there's a lot more exhaust in the air. So there's some things that you can do about it. Again, genetics, what you're born with is what you have. But one of the things we've learned about is that the genes that you're born with, or what genetics we call it, it's not that simple. There's also something called epigenetics that can impact that as well. So if you have an inherited risk for breast cancer, you've inherited a gene from your family, then what that does is it usually means that you cannot repair injuries from the environment as well as other people. So we're all exposed to all kinds of things. We're exposed to just background radiation. We're exposed to chemicals. We're exposed to exhaust. So, we may have taken a hormone or whatever. And those things cause injury to our cells, but most of the time our cells are built to repair those injuries or to recognize cancer cells and to kill them. But what happens is if you've inherited a gene, you have a defect in that ability to repair defects. So it just means that it takes fewer insults from the environment for you to develop cancer cells that your body is unable to fix or repair or recognize. So that's why you see people who have an inherited risk for breast cancer getting it at younger ages. You see it at 30 and 40 years old, is because it takes less insults from the environment to cause that to happen. So one of the things that's interesting is if you look at families that have the BRCA genes, if they were born before the age of 1940, they usually don't get the cancers as quite a young age as we see it now. So we think that that's more environmental factors in the world that we currently live in is why we're starting to see BRCA mutation carriers in their late 20s or early 30s. So there are genes, I said, that can predispose you to cancer, and those you can inherit. But there's some genes or something called epigenetics that are changes to your genes that happen just from life and living. So there's a whole new field now. It's kind of called the ghost in your genes. And it's the field of epigenetics. And we're learning that you can inherit changes in your genes from what your grandparents went through. So looking at it, like if your grandparents lived during a time of famine, then you may have inherited a change in your gene that would put you more at risk for hypertension or diabetes. So those are things that then we see being passed on. So it may explain why certain populations of people are more prone for certain things. If you look at their basic genetic structure, it's not in there, but these epigenes are things that happen in the environment, and they lay little molecules that turn certain genes on and off. So you see different expressions. We also know that some of those things can be reversed with diet and nutrition. So this is also explaining that you're getting effects from sort of non-genetic things that will impact the way that your genes express themselves. So the environment and epigenetics, and this is a kind of a busy slide, but it's just to show or kind of illustrate the point that things that happen in your environment and things that you are exposed to can then put these little molecules onto your gene and turn it on or off, which may make you more or less susceptible to cancer or other things. So you can see at the top, what would that be? To your left would be cancer, autoimmune disease, mental disorders, and diabetes are all things that we think are more related maybe to epigenetics and things that your parents or your forefathers were exposed to. And these genetic thumbprints do matter. For instance, Black women more frequently get breast cancer before the age of 35. And in fact, for all women diagnosed with breast cancer under the age of 44, it's a much higher incidence in Black women. And we usually teach you that if you have children at a young age, you have a lot of children and you breastfeed them, that decreases your risk for breast cancer. But actually for Black women, it's exactly the opposite. So doing that increases the risk of breast cancer, and we don't really understand why that is. It just is. In addition, oral contraceptives, we say for most people, either decreases the risk or doesn't affect it at all. But for Black women, somehow it does increase their risk for breast cancer because it stimulates insulin growth factor. So there are all these little things that we're learning are different depending on your heritage. Another interesting genetic imprint is looking at a study that came out of LA. They looked at different heritages, and they found that Japanese and Filipino women in LA had higher rates of breast cancer than Korean or Chinese women, and they're all from Asia. So why would that be? What's different about their genetic thumbprint? But even though they had this higher incidences, Japanese and Chinese women had a higher survival rate. Why is that? So there are all these little things that probably have to do with epigenetics that we're learning and we don't understand quite yet. African Americans have the worst survival rate for breast cancer, but they also tend to have triple negative breast cancer as well, a much higher incidence, and we know that's a more aggressive breast cancer. So that ties in. That's probably why. This is what I really find fascinating about epigenetics, and that is you would think that twins, if one twin gets breast cancer, very likely the next twin would get it because they have, especially identical twins, I'm talking about identical twins, because they have the same, they were born with the same exact genes. But it turns out that the older they get, the way the genes function is completely different. So identical twins have no higher incidence of breast cancer. So if one twin gets it, it's not very likely that the other twin would. And so they did a study where they looked at twins and they looked at newborns, and newborns, their genes were functioning exactly the same. But by the time they got to be 10 years old, they were very much different. And by the time they're 70, completely different, not even the same genetic function at all, even though they started out with the same imprint. And the difference is this epigenetics and what life and living in the environment puts onto your genes. We also look at the environment in terms of migration. So another clue to environmental risk factors is what happens to one group of population if they live in one country versus if they move and begin living in another country. And so there's several studies that show that women that, like Asian women, when they move to the United States, their risk of breast cancer starts to become similar to ours. And that has to do, I'm sure, with the environment, the food, and the environment that we live in. We, again, kind of touching on racial background and your genetic thumbprint. There's actually a study that looked at Hispanic Americans where they were looking at this sort of epigenetic things, and they could see that women that their families were exposed to DDT, that caused an epigenetic change that was then passed down through generations. So you can see higher incidences of breast cancer in young women whose grandmother or great-grandmother was exposed to DDT. Native Americans have the lowest incidence of breast cancer, and I never saw a reason why, but I bet it probably has something to do with food and maybe those rich omega-3s. That's just my own thoughts. So what else is in our environment? And that's radiation exposure. And there's always background radiation. So we get background radiation just from the sun, just in the dirt. There's one thing that you can maybe check, and that's radon. So I don't know if people know about, you can buy a little radon detector and check your home. And if your radon in your home is high, that means you need better ventilation. So I've actually had 2 people recently that did that and actually did have high radon. So you maybe something you want to think about checking your home for. If you work around radiation, usually there are a lot of safety measures that are performed. And in terms of medicine, we have to be more conscious, and I think recently we have been, about what kind of tests and things that we do, that we expose people to radiation that may later on be harmful, like how many times we order CT scans or chest x-rays, and things that we do that are exposing people to radiation, just to think about it, whether we really need that study. So we do radiation for therapy. So, when we do lumpectomies, which I'm sure a lot of people in the room have had, we add therapeutic radiation. And so then we're looking at the risk benefit. So we think at that situation, it lowers the risk of regrowing a breast cancer more than the risk of giving you another cancer years down the line. So we think that the benefit outweighs the risk. However, in women who are 35 years old or younger, that line begins to blur a lot. So it's a real discussion whether somebody who's less than 35 years old should have a lumpectomy with radiation, because irradiating young breast tissue is much more likely to result in another breast cancer in the future. That's the reason why young women who had Hodgkin's disease and were treated with mantle field radiation, which included part of the breast, when they're in their 20s, have a higher risk of breast cancer when they get to be in their 40s and early 50s. One of occupational exposures is flight attendants, because they're in the air. So when you take a lot of, if you travel by plane a lot, you're closer to the sun, and the radiation exposure is a little bit more. So they actually do have a higher incidence of breast and skin cancer, and we think maybe it's an occupational hazard having more exposure to background radiation. Before radiation safety protection came in, we used to see a lot of cancers in people that worked with x-rays. Now we're getting to the good part, I think. We are what we eat. So this is an area that's a little frustrating, and I think that we need to be, as a society, more vocal about, and we need to advocate more for ourselves. And that's what's allowed to be in our foods. So there's something called recombinant bovine growth hormone, which has been banned in Europe because of its association with breast cancer and prostate cancer, but it is the most commonly used hormone injected in the United States for our foods. This is also allowed in the United States. It's something called Ralgro. And it's also used to have our cows be fuller and produce more milk. And it's also an estradiol-like compound, so it can increase the risk of breast cancer as well. But this is also still legal in the United States. And I continue. So DDT was banned in the United States, but actually it's used in third world countries now. So hence you see an increasing incidence of breast cancer around the world. Atrazine is the most commonly used pesticide in the United States. It also was banned in Europe because of its association with increasing the risk of breast cancer. And for men, fertility, it can lower sperm counts, but it's still allowed in this country. So how many chemicals are there? I mean, when you look at this, it's almost kind of depressing because there are an estimated over 80,000 synthetic compounds that are, when you pick up things, the list of things that you can't pronounce goes on and on. But the toxicology screening available is really very minimal. So what do we know about? So we do know about dioxins, and this comes from vehicle exhaust. If you measure dioxins, you can measure it in the breast. So over time it accumulates. And maybe one of the reasons that breastfeeding decreases the risk of breast cancer is because when you breastfeed, you actually lower the dioxin in your breast because it goes out in the breast milk, which is not necessarily a cheery thought. But there it is. So, and it's one of the largest exposures in our current environment. So, exhaust goes into the air, then it rains, then it gets in the food and things, the grass that the animals are eating, and then we ingest it as well. So as I just mentioned, the lowest levels in your breast come after you just finish breastfeeding. And then the infamous BPA. So how many years did we drink out of bottles that had BPA in it and we didn't know any better? But once it's in your body, it's not like it really leaves per se, but at least now we know for our kids to be aware of it and for yourself to look for BPA free products. So that's something that we can control. And I think a lot more products are being made that are BPA free, but not all of them. So it's just to be aware and to ask that question. Then there's PAH, and this probably has something to do with the increased risk of cancer that's caused by smoking. But if you work around it, if you work where there's a lot of coal and diesel fuel, and if you grill a lot, that's the other thing. If you grill and you burn your food on the grill, you will get more PAH and you'll be consuming it. So one of the things I think is, to think about is a lot of people like to run, which is a healthy thing, but, don't run during rush hour, or if you can run where there's not a lot of exhaust, because then you're not taking in quite as much. And I think I forgot to mention that's probably what causes secondhand smoke. Causes secondhand smoke to be a cause of increased risk for cancer. One of the biggies that you can control too is cosmetics. So there are a lot of things that are in our shampoos, our soaps, our lotions, our lipsticks that cause an increased risk of breast cancer. In African Americans especially, a lot of the hair products and oils that we use are infused with placenta and all kinds of hormonal things, which may have something to do with maybe the young ages that we see breast cancer at. So parabens are, I think, probably the largest offender, and they're an antimicrobial, so they're put in there to try to keep bacteria from growing in the product. So it's for what was thought to be a good reason, but there are other ways to keep bacteria out of the cosmetics. And so you can look when you're buying products and see if they're paraben free. I wouldn't say go in and just throw out everything you have, but when you replace things, be aware of that and look for it. And it doesn't matter how much you spent on it. So, because some of the more expensive cosmetics are full of paraben, and then you can get cheaper cosmetics that are not. So you just have to be aware and look for that. This is one that was very interesting, and it was a environmental work group, or EWG, which has a fantastic website. So they have a ton of information on environmental risk, and they actually have information on cosmetic products and lotions. So if you want to see what the environmental safety is for anything, any cosmetic, pretty much you can put it in there and it will tell you how much paraben or other things that I maybe have not mentioned that might not be good or are associated with a higher risk of cancer or other diseases. And they will tell you. So they did a study and they looked at teenagers from across the country, so from the South, from the Northeast, West, and they found that girls tested really high for paraben levels in their body and other detrimental chemicals. And if you think about it, our teenagers use a lot of cosmetic products. They're putting on, they're shampooing their hair, then they're putting on, you know, moisturizer, mascara, lipstick, lotions, creams, foot cream, perfume. I mean, if you think about it, a lot of daily exposure. And I just wanted to briefly show, can you turn this video on for me? Thank you. Uh-oh. Is it not going to work? Oh, well. Okay. So what? Oh, you going to try it one more time? See if it works. Nope. Okay. So basically, it was just a little video vignette on the story of cosmetics and what you have in your bathroom and at your home that's impacting your family, the things, what you're putting on your kids, what you're putting on yourself, and what's in them, and the known things that are in them that can cause cancer. And then it talks about advocating for change. Yeah, so you can, I'm trying to think. I'll have to, I'll put it up on, I'll let Coleman know which website it is. But I think maybe if you Google the story of cosmetics, it would come up. And then I was only going to show a short portion of it, but it will show that to you. I think the other thing that's on there now with EWG is one on about the difference between organic and natural, which if you don't know, natural really doesn't mean anything. It just is it's a marketing to make you buy something because it says natural, so that makes you think it's more healthy. But natural is just, they can put it on there. It doesn't mean that they've met any specific things. It can be full of chemicals and they can put natural on it. So if you say, if your food says natural, then it's probably not. But organic means that they did have to meet, it had to be grown in a certain way and so forth. So organic is more likely to mean you're getting something that's healthy, whereas natural doesn't mean anything. Again, occupational risk. So there is some data that shows that people that work night shifts have a higher incidence of breast cancer. And it may have to do something with melatonin, because if you work at night, you have lower melatonin levels. And melatonin, actually taking it, has been shown to decrease the risk of breast cancer or breast cancer recurrence. So that ties in somehow. There's a lot of concern about electromagnetic fields and, you know, people living near poles and electrical wires, but there's actually no good data that shows that that really increases risk of breast cancer or any other kinds of cancer, even though we worry about it. Oh, there, I said it. Now, another interesting finding is that Black women have an increased risk of breast cancer if they use a waterbed or heating blankets. Weird. So this is a really super busy slide, but this shows is that there's so much in the environment that can impact your risk for getting cancer. And there's a lot of it that you really have no control over. But I think the good thing is that there are a lot of things that you do have control over. So you can minimize the use of plastic wraps and containers because maybe we're not using BPA, but what are they lining the stuff with now? Who knows? So if you can use glass containers, that's better. If you can store things in glass, that's better. Try not to microwave your food in a plastic container. So sometimes we get stuff and, in life, sometimes you have, we got fast food, we're going to microwave. But if you buy things, put it onto a glass plate and microwave it. Don't microwave it in the packaging because when you do that, you leach chemicals from the packaging into your food. So try to be aware of that. The other thing is washing your plastics in the dishwasher because you help to unleash the chemicals that will then get into your food. Again, we talked about using glass bottles to cook with iron, or if you use Teflon. I mean, the purist would say don't use Teflon. If you cook like me, maybe it helps. But if you get a scratch in the surface, then the plastics and chemicals start getting into your food. So if you use Teflon, if it gets scratched, then it's time to get another pan. And we talked about the exhaust fumes. You can watch your weight. It's not easy, but you can. So really being conscious of your calorie intake, your exercise, watching your consumption of alcohol, those are all things that you have control over. You can control that risk. And there's no data that dyeing your hair makes any difference. And before I went gray, this was more important to me. But for those of you who are coloring, it's okay. This is I kind of talked about this, but this was just to key me up on talking about natural versus organic. And then I just wanted to say a little something about olive oil because that's one of the things that we really promote now is olive oil is better to cook with. It's part of the Mediterranean diet. But just so you know, not all olive oil is actually olive oil, even if it says extra virgin. So what they're doing is it's really expensive to make extra virgin olive oil. So there's some companies that are inputting it and putting in vegetable oil and other oils into the olive oil. And then they're selling it as extra virgin olive oil. So you just have to be careful when you're buying. You can actually ask, is this truly all for olive oil? And I think with that I'll end. Thank you so much. Okay. Well, I have to say, honestly, most women that get breast cancer don't have a lot of risk factors. So I do think a lot of it is environmental risk. I think one of my my memories is a young lady that I saw who was in her 40s, I think 40, 41, and she had been a vegetarian since she was 12, and she had her period early, she had her kids early, she had 5 kids, she breastfed them all for years. I mean, if anybody shouldn't have gotten breast cancer, it was her. And she just looked at me and said, I just feel like I should go out and have a big fat hamburger. I was like, well, Helvetia Taverns makes a mean burger. You know, so I think that sometimes no matter what you do, it just happens. So it could be that, you know, multiple things, I don't know, whether you drink or not, or just the fumes, the dioxin, the BPA. You know, maybe her mom gave her juice that was in a BPA container for her, you know, her childhood. So even though she didn't, you know, she was a vegetarian and didn't eat, you know, food sprayed with all kinds of things, and you can't control everything. So I think that the answer is we do the best that we can. Oops. My Elton John glasses. Is the radiation in the microwave harmful? So microwaving food is not advisable. So the answer, to the best of my ability, what you're doing in the microwave is you're actually producing radiation at the moment, and it gives energy into the food that heats it. So it's supposed to be safe to stand near the microwave, but I actually, whenever I push it on, I always step back a couple of feet, because that's when there's actually energy being produced. I think once the food is warmed up, the energy's been deposited and it's okay. So that would be the answer to that question that I would give. Hormone replacement therapy. Is there a difference in breast cancer to someone who has used traditional hormone replacement therapy versus bioidentical hormones? So I think that's a mixed answer. There's some data to suggest maybe bioidenticals are a little bit less, but overall, using hormone replacement therapy of no matter what type is associated with a higher risk of breast cancer. And using estrogen and progesterone combined is associated with more of a risk than using estrogen alone. Oh, and this person asked if I was willing to share my breast cancer story, and I am, but maybe I'll answer the other questions, and then if we have time, I would love to share my story. Is it true that vitamin D levels, if they are low, increase the risk of reoccurrence of breast cancer? Yes, there are a couple studies that show that women that continue to have lower levels of vitamin D do have a higher risk of breast cancer recurrence. So I recommend everybody take supplementation, not only to reduce risk of recurrence, but it reduces risk of getting it in the beginning. So I recognize that. So there are various papers, but I think the level that you should probably be around is about 50. Somewhere between 50 to 70 seems to be the most protective. How do fat deposits hold on to cancer? Fat cells have an affinity for estrogen, and they also have aromatase in them. So fat cells can turn male hormones even into female hormones. So they can change even testosterone into a weak estrogen, estradiol. So they also are impacted by the aromatase inhibitors. And that was part of the reason why there was a study that came out showing that maybe women who were overweight didn't get as much benefit from aromatase inhibitors, because maybe the dosing we were using was not quite enough if you're really heavy, because the fat cells also have aromatase. Okay, so when before menopause, the bulk of the estrogen and hormones, female hormones, come from your ovaries. After menopause, most of it comes from your adrenal glands, and there's a little enzyme called aromatase that changes the steroid into female hormones. So so that's what aromatase inhibitors are, is when you have to be postmenopausal for that reason, because it only works on the adrenal glands and maybe fat. And so it blocks that enzyme from converting steroids into estrogen. So that's how that works. This is from our friends in Bend. Oh, okay, via video cam. Hi, Bend. In a family with no history of breast cancer, does a sister's risk to develop breast cancer increase when another sister is diagnosed with breast cancer? So that's kind of a complex question. Just because it's multifold, as I talked about with identical twins, just because one twin gets breast cancer doesn't mean the other one will. So if a sister gets breast cancer and they have completely different lives and environmental exposures, maybe it has no increased risk at all. It also depends on age. Like if one sister is 32 years old and gets breast cancer, I'd be more worried about the risk for another sister, because that's pretty young and you begin to think that there's either a mutation, a genetic mutation, versus if the sister's 70 years old, then that kind of comes from life and living, more likely the environmental risk factors, and therefore I wouldn't think that the second sister has a risk. There is a gene that codes for breast cancer over the age of 50. So if you see families with a lot of women who are 50 and 60 years old when they get breast cancer, then I actually do become a little bit more concerned about it. And that genetic mutation is called CHEK2, and it is now testable. So, so that would also be a possibility, depending on the family history. And I hope I answered that question from Ben. Did European breast cancer rates fall when banned substances like atrazine and recombinant bovine growth hormone become banned? I do not know the answer to that question, so I will look it up and see if I can find it, and I'll put it up on the website if I do. That's a very interesting question. I don't know, maybe they were using hormone replacement therapy too. I've heard that BSGI gives a lot of radiation. Why would this be used over MRI, especially yearly as a screening tool? Would you recommend BSGI for women less than 35? So that's an excellent question. When BSGI was first described, it was in the era before we were conscious of the radiation exposure and being thoughtful about that. So when it first came out, we were using it for screening. But then when we started to be more aware of that, we don't use it for screening anymore. However, it's no more radiation than a CT scan. So it's used for diagnosis, and actually for a woman who has a newly diagnosed breast cancer, it is actually more accurate than an MRI. So it's just as good at MRI as finding a cancer, but why it's more accurate is MRI tends to have a lot of false positives or show a lot of other things in the breast that you don't need to know about, and then we do other biopsies because we're worried it's cancer. BSGI doesn't tend to do that. So it's more accurate with less false positives, and it's a lot cheaper. It's like $900 and an MRI is $3,500. So it's more cost effective as well. So to use it as a diagnostic tool is how we are using it now. They are actually working on getting the dosing down to the point where it would be equivalent to a mammogram, but we have to do studies to see if the image quality will still be as good if we lower the dose. So there's more to come, I think, in the coming years on that. BSGI is breast-specific gamma imaging, so it's a functional image of the breast. It's kind of like getting a PET scan of the breast. And so what it does is it lights up any areas where the cells are overly active. So it tends to light up cancer and not light up benign things. Hormone replacement therapy and breast cancer incidence and increase. Was the majority a hormone receptor type or HER2 positive or negative? So for women that use hormone replacement therapy, it does increase the risk of breast cancer, but it tends to give you hormone-positive breast cancer. So it increases your risk for breast cancer, but it gives you better breast cancer, so you're more likely to survive it if you get it. So go figure. In the government, who is protecting our food and cosmetics? Selma said no one. So clearly they're advocacy groups. So this EWG or environmental work group. Thank you, Nicole. Environmental work group. Is really a great organization. They do a lot of advocacy. So if you want to be proactive, I think that's a good organization to give through. There are other organizations that are doing that. Komen actually has been advocating for environmental protection. Of course, the companies have a big lobby, so it's really hard to fight, food and cosmetic industry. It's amazing. But, we the people, so we must press on. I always feel like you can never give up. You just have to keep doing that. You can always email your senators and your representatives to say that this is an important thing. And, maybe we should be the ones to put, something on the ballot about this in Oregon. So dream big.
This question, why don't you read the question? Miles Hassel answered this one in one way, and I don't know if Dr. Johnson's going to answer it a different way.
Okay, how important is it to choose organic food over just getting fresh vegetables? So that's a complex question because not all things need to be organic, really. So there's some fruits and vegetables that it doesn't matter if it's organic and others where it does. So things where you're going to eat the skin, it's more like that would be a good choice to get organic, but like a banana where you're just going to peel the skin and throw it away, less so. So I think that that's a mixed answer. And then sometimes organic can really be expensive. So just making a choice over what things you want to get organic, I really think meats and vegetables and dairy things are very important because as you can see, our cows and chicken, they're injected with all sorts of things. So that's important, but it's also very expensive. So it's looking at what's in your budget and what you can afford, I think plays a big role in what you buy as well. Did I answer similarly? What did he say?
Similar question. Yeah, he was kind of, it's more important to eat the fresh foods, and there isn't a whole lot that shows that organic is better, but it kind of makes sense.
Roseburg. Hi, Roseburg. Is there a risk of cooking with cast iron after chemotherapy? No, cast iron is good. Cast iron is a good way to cook. Grilling with natural gas versus briquettes. That's a tough question because I think grilling in general, you would just want to make sure that you're not burning because it's all gas. So briquettes, maybe a little bit more of the dioxides would be in it, a little more tasty. How to pick your, make good choices. But I think the important thing is not to burn. Whichever way you do, don't burn. What is the website for checking the safety of cosmetic products? So it was the Environmental Work Group, or EWG, is a great website for checking the cosmetic products. Somebody else says Skin Deep is another good one. I've not been to Skin Deep, but oh, it is part of EWG. Okay. Oh, how do you know if truly olive oil? Not always on the label, and that's a good question. Sometimes I think it's difficult. You maybe can, well, I've asked at the store, they don't always know either. So you maybe look at where it's produced, because sometimes if you see that it was produced in Italy, yeah, Italy, yeah. You know, if it's coming from Brussels or Colombia or someplace else, and then it's probably mixed.
I think back on there was Italy was I lived with a dietitian in the office, and Italy was one of the ones where they are bringing in importing olive oil from other countries and mixing it with other oils, and because their laws say if it was manufactured in Italy, it can be anything. So there was quite a large ad in the New York Times about Italian olive oils being something to be careful of.
Yeah. Yeah, go ahead.
A guy just recently wrote a book about olive oil, and the problem with Italian olive oil is there's such a premium on it that if you're not very honest, you can really make a killing. And I believe I'm sure I heard this story on NPR, but he said that he had started a website which will tell you, brands that he knows that are very reliable. I also think maybe, you have to look out for things like Mediterranean olive oil. It can be from anywhere in the Mediterranean. Some things will say Italian olive oil, but it will say bottled in Italy, which means it could be from anywhere.
Yeah, and again, it does. Even if it says extra virgin, it might not be.
So there's definitely resources online to help you figure out what your best bet is.
Does cold press also get involved in the importance of what one you choose?
Yeah, it's not extra virgin, it's not cold press.
Okay, so the two.
Yeah. Okay, Bend again. With new recommendations for screening dense breasts, is screening mammography still the gold standard? Yes. So I'm gonna just I did this a little bit ago, but it's really unfortunate the way the media has been portraying screening, and most recently this study from Canada is really sad the way that they're giving out the information, because it's not really being forthcoming. So studies consistently have shown that screening mammography saves lives, and if you're being screened and your tumor is found at a smaller stage, that does result in a better outcome. No question. The most recent study that came out of Canada, the study was actually performed over 25 years ago. And on the study, they say that there is no difference in outcome between the women who were screened and the women who were not screened. But what they don't tell you is that in the women that were screened, most of them had a palpable tumor, which means that they weren't doing good screening. So, and in fact, when they did it, they examined them first, and if they could feel a tumor, they put them in the screening group, which is exactly the opposite of what you're supposed to do. So that's why there's no difference, is because they were no different really tumor sizes. They were both, the group that was screened had an average size of 19 millimeters, and the group that wasn't was 21. That's 2 millimeter difference is not clinically relevant. So that's why the outcome is the same. But in the same paper, they also say that when they took out all the women that had palpable tumors and really just looked at the ones that were only found by screening mammography, the average size was 1.4 centimeters, and those women had a 30% better outcome. So basically, the study does show that screening helps. It's just that it was more sensational to present it in the way that they did. And also, the studies that are coming out saying that screening, should we be screening, they also say that we have such good treatment for breast cancer that we really don't need to worry about screening anymore. So, but how can you reconcile that with the fact that breast cancer is the second leading cause of death of women in this country if our treatment is so good? And it's gotten a lot better, but it's not perfect. And so the answer is early detection. So Mammograms save lives, screening saves lives. And I just want to meet Dr. Blyer. So he made a comment. He wrote the article that came out in the New England Journal of Medicine last year, and in which he said, we have such good treatment for breast cancer, we don't really need to worry about screening. And in the New England Journal of Medicine, it says, we have good treatment for pneumonia, we don't screen for that. Like, you know, a Z-Pak and adriamycin are the same thing. You know, really, it's incomprehensible. So that's the logic behind not screening. And that's why the American Cancer Society, the Society of Surgical Oncology, the American College of Gynecology, you know, everybody else says you start screening at age 40 and do it annually, is because mammograms and screening does save lives. Yeah. That would be, because if you have so she's asking for women that have had bilateral nipple sparing mastectomy, if they're asked to have mammograms, should they be having mammograms or should they get BSGI or MRI? So actually, if you've had a nipple sparing mastectomy, you should not need any imaging study because you shouldn't have any breast tissue. So the nipple is left there. Really, we're just leaving the skin, but you should be taking all the ductal tissue. So maybe there's 2 or 3 millimeters of ductal tissue in the actual nipple bud. And if something were to happen there, you could feel it just by feeling the nipple. And the studies show there's a less than 1% chance of getting a recurrence right in the nipple. So it would be the same as a traditional mastectomy, which we don't usually image because there's no breast tissue. So MRIs are done after reconstruction if you had it done with implants every so often, just to check the integrity of the implant. What about soy products, food, lotion, etc.? So soy products, there's been a lot of controversy about that over the years, and we initially told people to avoid soy, especially if you had estrogen-positive breast cancer, and that soy was linked to an increased risk of breast cancer, which never made sense to me because the areas in the world where they eat the most soy have the lowest incidence of breast cancer. It just never made sense to me. And I think what we did is we broke down chemicals and we would just check one chemical at a time from the soy as opposed to looking at it the way that God made it in nature. So there are some newer studies now showing that women that have soy in their diet with estrogen-positive breast cancer actually have a better outcome than women that have none at all. And the more that you have, the better. So the initial studies looking at that came out of Asia, and people thought, well, it's just for Asian people. But more recently, there were 2 studies that came out of Germany showing the same thing. So I no longer tell people to avoid it. And then lotions, I think it's the same thing, the parabens, or you want to avoid. Some people get things specifically with progesterone in it. Probably not a good idea. Is Teflon referring to a specific registered brand or referring to all non-stick surfaces? So I'm talking about all non-stick surfaces. Wow, that's a lot of questions. Why wouldn't you tell people to stop using products containing parabens immediately? The reason I wouldn't is because you've been using it all this time and you probably have levels in your body. So finishing your bottle of lotion or whatever, in the grander scheme of things, probably isn't going to change anything. And probably personally, when I read about it, I went to throw out everything and I started adding up how much it would cost to replace it immediately. So that's what I did when I finish something and I'm buying something new. Then I look and make sure that what I'm replacing it with is a better product. What cleaning chemicals are made safer and which substances are more harmful? That's a really good question, and I actually don't have a super good answer to it. But I would take you back to the EWG website, because they have an abundance of information about cleaning products, household products, foods. They actually have a really good information about foods and whether organic or genetically engineered. They have a really good section. So that's a great website to, I think, get answers about all of that. And that kind of speaks to the next question. What do you think about a watch and wait approach to DCIS instead of resection and radiation therapy? So there has been a lot of data on DCIS not truly being cancer. And that over the years, I think that I've grown to have a lot more respect for ductal carcinoma in situ. There are studies done on it, and women that have it resected with no additional therapy, depending on the type that they have, there's up to a 40% chance of it growing back, and half of the time it comes back as invasive breast cancer. So I have a very healthy respect for DCIS, because I have taken care of people over the years that elected not to do anything about it, and I have to say I've seen every one of them back. Even though, you would think 60% of them would come back without anything. So I think the low-grade DCIS is the one that will take the longest to become something. And I think it depends on your age. So if you're 85 years old and you have low-grade DCIS, you may make it to 100 and it never bother you. But if you're 42 years old and you have low-grade DCIS, then within your lifetime, you're probably going to have a problem. So I think each person, should discuss it with their care provider individually. If you have high-grade DCIS, far more likely that you're going to have a problem. And we're working on looking at genetics of different cells in DCIS. So maybe in the future we'll be able to separate out genetically the DCIS that's going to go on and become invasive and become a problem versus a DCIS that will sit there for 20 years and never bother. But we're just not to that point just yet. How do you feel about cutting back on mammograms for over 75 age group? What is your thinking about how often for that age group? So that's a great question. So if you're over 75 years old, it depends on what kind of condition or shape you're in. If you're 78 years old, but you still walk 2 or 3 miles a day, live alone, can run up steps, you're probably going to live to be 100. You might want to continue screening, and it would be reasonable to do it every other year as opposed to every year. If you're 75 years old and you're taking a lot of medications, you have trouble walking, and you've got heart problems and lung problems, then maybe you don't want to be screened anymore, because your life expectancy may not be as long. So it's something to discuss with your doctor, what else you have going on and what your health is like, and whether it makes sense to continue screening over the age of 75 or not. If you're a healthy, vibrant 75-year-old, then I would think you continue. Oh, thank you. So I recently read an article in I can't read that. Nature, okay, Conservancy publication that addressed prenatal exposure to many, if not all, of the toxins outlined in your presentation, and the eventual development of neurologic problems in the developing child. The article referenced a book written by a Danish scientist, Only One Chance, talking about this subject. I haven't read the book. Are you familiar with this research? I haven't read this particular book, but yes. So all the chemicals that we as moms have in our body are entering our kids when they're developing. And you actually can see, like in animals, changes like not developing sperm or male species becoming more effeminate because of the chemicals that are in our water and foods that the animals are exposed to. So yes, we're all born with if you test a newborn, they're going to have these chemicals in their body. And, I talked about the breastfeeding and the dioxin. So, we're living in a world of chemicals. So you want to do your best with the things that you can modify. I think that makes it even more important to do the exercise, watch the alcohol, all the things that you can control, because there's so much that you can't. Thank you. Do we have any time? Okay, we have 5 minutes, so I'll share my story. Does anybody have any other questions? Other questions? Okay. Okay. So in May, the end of May, I went to my son's wedding. He's 26 years old. And when I got back, couple months overdue for my mammogram, I went in and had my mammogram just routinely performed. And I left. I looked at the 2D images and I left. And I said, I'm good. And then I got a call from one of the radiologists saying, well, your 2D images look great, but on the 3D mammogram, there's this little blip that I think you need to come back for. So I went back over and looked at it, and he said, well, maybe it's a cyst or something. I'm like, oh, no, I know what that is. I can see that. And sure enough, I had breast cancer. So the next part was I was like, oh, Lord, please give me one of those nicely ER/PR positive, tamoxifen sensitive breast cancers. That way I can control my life. I can take tamoxifen, then I can figure out when I want to have surgery. But it came back ER positive, less PR positive, HER2 new positive. So I thought, okay, Lord, here we go. I have to have chemotherapy. And I won't be able to control my life or my schedule. I'm just going to have to roll with the flow. And so that's what I did. So I went ahead and had neoadjuvant chemotherapy because I strongly believe in understanding the results of the treatment on your cancer. And so I had that done, and I did have a response. I actually had to get a node biopsy because Dr. Vuki had the nerve of ordering a PET CT scan, which I told her I absolutely didn't need because of my stage. She didn't listen to me, and my husband said, stop treating yourself. And so I did have a node, but the needle biopsy was negative. I went ahead and did the chemotherapy and then went on to surgery. When I was starting chemotherapy, at first I thought that I wanted to try to be very private about it because, there can be a lot of fallout. And I actually did have a couple people call and say, I don't want you to take care of me because I'm not sure you're on your game, or, maybe you're going to be, off or not safe, which I understood. I mean, that's it's their experience as well. They're walking through their own thing, and I just love them for that. And it was all good. But I initially wanted to kind of be private. So my husband and I got online, and I was trying to buy a wig because I had really long hair, so to try to match it and everything. We finally did find one. It was a little on the spendy side. And then I got it, and I thought, it just doesn't feel like me. So I just went and shaved my head, and I realized that my head was actually pretty good. So I've never worn the wig, and my husband was like, I wish you'd figured that out before we spent the money. So I, walked through chemo, and I have to say that although I, over the past 20 years, I've walked through so many with so many people, and I really thought that I heard and understood and tried to relate the experience. Now that I've done it myself, I have such a deeper understanding. And I really feel like, God allows certain things in your life because you can really help others when you've walked through something yourself. So I really understand it at a deeper level. It's been really good for my marriage. My husband has been my rock, and I always thought he was very vested in the long hair, but he doesn't care that I don't have any hair. He didn't care when I had no hair. And, I chose bilateral mastectomies myself, and he didn't care whether I had reconstruction. Just massaging my feet, my kids, just loving me and being there for me. It's been amazing. And then I have to say the outpouring of love from everybody that, found out. I got so many cards and letters, and what a blessing it has been for me just to hear from people that, I took care of 20 years ago, and for them to send me back cards and books and love. And it just shows you that when you put love and positive energy in, you get it back multiple fold. I mean, it's been such a blessing for me that I just almost feel like I don't want to say it's been a happy experience, but I wouldn't want to do it again. But it's been really such a good experience. And then just being able to hold someone else now and say, I feel you. When they say, I don't want to do chemotherapy, I feel you. When you hear that, you thought your regimen was going to end at one time and then they're adding more, I really feel that. I mean, I really get that now. So I think that it's been a good thing, and I just hope that I'm around many, many, many years more to just love on other people and to pay it forward. So thank you for listening to me and for allowing me to share my story.